what I think has been the best and that I've used it for the most so far is absolutely skin rejuvenation. And of course, you can make the argument that melasma and rosacea are medical conditions as well. So this is where it all begins to blend together. And for my colleagues, many dermatologists don't do a lot of aesthetic treatments, and it's been their choice. But the lines get a little blurred here, and I think in a way this is great for everybody because even if you're a medical dermatologist who does not do Botox or fillers, your patients are going to be very happy with the treatment for rosacea, for melasma. They're going to look better on a lot of different levels, and we're going to see this here. When you do essentially the full facial treatment, which we would do the same treatment for rosacea, for melasma, for skin rejuvenation, tightening, collagen improvement, you're treating it in exactly the same way. So everything occurs simultaneously. It is addressing texture at the same time as redness, at the same time as pigmentation, at the same time as laxity and pores and sun damage and veins and age spots. Now, sometimes we can, at the end of the treatment, if you have spider veins, let's say, then you're going to switch your handpiece and deliberately treat them. But the whole treatment altogether does all of this at the same time. Patients have mentioned this shrink wrapping feeling that they get, this feeling of tightness. And I've had several patients, not just one or two, but several, get up from the table, look at their skin in the mirror and say, it looks better already. And I've frankly never had that to that degree with other lasers. We all know there's a placebo effect, of course, with everything that we do. And you got to wonder sometimes, how much of that is happening. But I've had patients that are really not that way, not likely to be overly happy about things, who really were. And certainly by the time I see them back in 4 weeks, they are absolutely happy. As Kevin Pinsky astutely points out here, normally the treatment of this range of conditions requires 3 to 4 different types of lasers. I'll give you an example of a woman I had in my office last week, African American woman, late 50s. She still had some acne. She had some hyperpigmentation from the acne as well as some melasma. So these were her main complaints. I said, okay, we're going to use this laser called the Neo. And here's why. Number one, you're African American and this can still treat you. Many other lasers cannot. Number two, it will treat your dark spots that you have. Number three, it will treat your acne. Number four, you're over 55 years old and we all can use skin tightening and neocollagenesis. It's going to help, your tightening and your fine lines. Oh, and as I'm turning her head from side to side and putting my thumb underneath her chin, I feel a little bit of stubble there. And I said, shave before your treatment because it is going to get rid of that hair as well. It does actually quite well for hair removal. So this one person had 5 indications for this laser. It sells itself. It sells itself. People are just taking the brochures. I'm talking to them about it in a three sentence conversation, and they are, setting up appointments for this treatment. Okay, so here's an example, again, one of Dr. Pinsky's patients, and look closely here. You can see not only is her cheek tighter, and not only is the marionette area pulled up and the nasolabial area pulled up, but the skin texture is better. The jawline is better defined. There's decreased redness. This woman looks so much better, all naturally, all normally. I mean, people are loving this.